Cannabis, or marijuana, commonly known by its street name weed, is a drug that comes along with many issues. According to the National Institute on Drug Issues, marijuana is the most commonly used illicit substance, especially among young teenagers from the age of 12. Okay, so who exactly does this affect? Well, the teens themselves in form of their physical well-being, the families who have to support them economically having negative impacts on it, and this causes fracture between family members or friction, which could lead to arguments and even divorce between the parents, resulting in negative psychological impacts on the family as a whole. This leads me to discuss the social issues or social effects of marijuana. See, marijuana has many effects, negative effects on attention, the memory of the addictees, and their learning. This could last for a long time depending on how much they took, which could result to poor education outcomes or even less likely to graduate compared to those who do not take the drug. This doesn't stop there because it goes on to later life where they become dependent on the drug, which could result in lower income or unemployment, criminal behavior, and or lower life satisfaction. So this leads me to ask, what is it that causes them to take this drug? For first of all, at such a young age, curiosity is the main suspect. And secondly, peer pressure, the need of wanting to fit in with a gang or the group, which links back to the social issues and brings me to talk about the environmental impacts or environmental reasons why they could take this drug at such a young age. First of all, their family members could be taking the drug and they would think that it's a normal thing to do, or coming from a broken family, which results in stress and then they end up using the drug too. So, how could we help the teenagers to stop or reduce the effects of the drug? Well, they could eat the drug other than smoking it, or smoke less of it, or we could have a look at the Ottawa Charter and discuss reasons or ways that we could help them reduce the effects or stop smoking altogether. First of all, creating supportive environments. First of all, parents need to listen to their children and their issues because according to Lockhart, a textbook in 2010, it says we need to take care of each other, our community, and our environments. Secondly, we need to provide self help materials for these addictees like flyers, brochures, and free help online like the KHL. The ABC 2003 says this could decrease the usage rate, even help quit. Secondly, we need to strengthen the community action. We could do this by creating support groups for the addicts by, for example, according to the United Kingdom CIA, they end up feeling extreme paranoia or even unwanted. Having these support groups can be a great help for them. Secondly, ex cannabis users can help them look at the drug and in a different perspective and could even lead them to quitting. Quit Victoria says that showing you care and sharing your past experiences can help them and go a long way. Thirdly, we could develop their personal skills. This could be done by first of all providing in school, learning ways or places that they could learn the effects of marijuana. According to the World Health Organization, this article clearly states that that is a good idea. Secondly, we need to encourage or get them to talk about their issues and the roots of their issue. School Drug Education 2007 says that teenagers respond well when they talk and realize the implications of the drug. The fourth thing that we could do is reorient health service. First, we need to increase availability of the professionals for them to talk to, like chaplains in school. And government of Victoria does say that teens respond well when listened to, like mentioned before. And secondly, healthcare facilities and services need to be provided more of it. According to Lockhart, several services in one location are needed or several in several areas, and the availability of the professionals could go a long way and help. Thirdly, we need to build healthy public policy. First of all, laws against teenagers that smoke needs to be stricter. according to the NCPIC. This is a very upsetting to see that they have very little things. Sorry, the fine that they have to pay is very little, that goes to as low as $50, which is kind of disheartening to think that they can smoke all they want and only pay $50. So the laws need to be much more strict. Secondly, parents that supply or condone this need to be charged against, simply because it's a criminal offense to supply drugs to young teenagers. Thank you.